Hi everyone, welcome. I'm here today with Dr. Cathy Brodows from Southport Chiropractic. Thank you so much for joining us today.
Happy to be here.
So we're going to talk about the most common ailments that affect pregnant women. And I said to Cathy earlier, I only had my 2.5-year-old, obviously 2.5 years ago. So I feel so familiar. And she was like, well, these are some of the things. And I said, well, funny enough, those are some of the things that some of our mums have written in about. It was all the things that affected me.
Yeah, you said you had every one of them.
I can literally tick a box for every single thing that we're going to talk about today. So first of all, explain to all of us, why does this happen? Why do we get all of these problems when we're pregnant?
Well, I mean, the big reasons is your body's changing. You're putting on a lot of weight really quickly. So your body has to get used to that. It's never fun to be more weight than you're used to.
Yeah.
But then the other thing is our ligaments get weakened when we're pregnant. And that's good, and that's normal for when we're having a baby. But for the 9 months before that, our ligaments, our muscles, our joints are all actually a little weaker. And when they're a little weaker, you're more likely to get some of the symptoms that other people have after injuries.
And I suppose as well, if you've got old injuries, that probably just exacerbates it.
Exactly.
Doesn't it?
So
right.
If you have a history of sciatica when you're pregnant, you just might get that sciatica come back.
Right. Okay.
Yeah.
Okay. Tell us a little bit about your practice first of all, before we launch into some of the other areas. So you're based in Southport. How did you get into chiropractic?
Yeah, we're technically in Fairfield.
Oh, you are?
We are.
Oh, okay.
Yeah, I've been in chiropractic for over 20 years now.
Right.
And I mean, the long story of it is I always wanted to be a doctor from the time I was a little kid, and I was kind of going towards medical school at the time, even through college, but I met a cute guy in college.
As you do.
It's the story. And he said, you really need to look into chiropractic, and I didn't know much about it except chiropractors help backs. My dad used to go to a chiropractor for his back. So he put me in touch with someone in college, and I started to look into it, and things unfolded. Yeah,
Great, that's brilliant. I love that story. And you've got 3 kids yourself, haven't you?
I do.
What are their ages?
My son is almost 18. My daughter's almost 16, and I have a little one who's 10.
So you've done the pregnancy thing. Did you have any of these issues when you were pregnant?
You know, I didn't actually. I had a few of them. I mean, I had my last one. I had some back pain shortly after I found out I was pregnant. So I didn't have all the things a mom has because I knew how to kind of almost preempt my body into what I need to do. But yeah, a little bit of reflux as I was going towards the 8th or 9th month. You know, maybe a little hand pain at one point in time. Yeah.
Well, so what we're going to talk about today is, as I mentioned, some of the really common things that people come to see Cathy about. And not only did Cathy say, well, these are the really common things, but we also had mums write in and say, actually, these are the things that I've experienced. And they matched. So we're definitely going down the right road.
Awesome.
So first of all, let's talk about sciatica, which I had. Oh, I would put my foot down, my left foot, and I would practically collapse. So tell us, why does that happen? What can we do to help a mum that's sitting there at the moment going, I've got that?
Right, so let me just say this, sciatica is just a word to a lot of people. So sciatica is, you know, by definition is pressure on a nerve. It happens to be the biggest nerve of the body. It's about this thick. It goes all the way, you know, from your low back down, your buttock into your leg. And sciatica just means there's pressure somewhere along that nerve. And often the symptoms are like what you had. It could be burning, numbing, tingling, sharp pain, anywhere along that nerve. So what happens in pregnancy is if you have extra inflammation in your body, if you have weakened joints in your body, if you have a history of back problems, that nerve can become impinged. And that's what we call sciatica. So a lot of pregnant people have it. We see it a lot even without pregnant people, but the moment you start to have this extra weight or the vulnerability to the joints, you can see it faster. One of the best things I say when people are starting to have sciatica is actually not what you think. Most people think I better stop working out, I better sit down. For pregnant people, I say you better walk a little bit. Keep moving. There's a great stretch. It doesn't always help, and it's not ideal for every pregnant person. But in yoga, it's known as the bridge, where you're on your back, your feet are up on the floor.
Your bum's up.
And you elevate your bum. And you hold it there for about 20 seconds, and then release it down. If you do that a few times, sometimes it can ease the low back, which will ease the pressure on the nerve. Those are some alternatives.
That's amazing.
Yeah.
So question for you, when our mums start to get, so let's say all of a sudden they're going, oh my God, that's really hurting. What's the first point of call? To try a stretch or to come to you?
I would actually try to walk a little bit, try to stretch. See, sometimes your pelvis, because everything's unstable, shifts. And it can shift and cause pressure on the nerve. Sometimes it's just a matter of can you shift things back. So walk, stretch a little bit, see if it helps. And a lot of people do that, It's when days or weeks go by, it's not getting better, that often you need something to intervene and help you out. Because as you're getting bigger, it might even get worse.
Of course. Yeah, that makes complete sense.
Yeah.
So the next one I wanted to talk to you about is going back to back pain, because I have old injuries from when I was sort of in my teenage years, whiplash. And again, I'm the tick box for this because I had so much back pain. It was constant for me. What things can you do to kind of maybe alleviate that?
Wow. So, it's hard when you're pregnant. I always say before you're even pregnant, when you're in the first stretch, trying to get pregnant, or even if you're not pregnant, not even planning to have pregnant, the best thing you can do is always assume some stress is going to come in your life.
Yeah.
And prepare for that. And how do you prepare for that? You stretch. You exercise regularly, you eat healthy. That's before you're even pregnant.
Yeah.
Once you're pregnant, the answer is actually pretty easy. Keep doing it.
Yeah.
That's it. So it's a little different when you're pregnant and you really haven't exercised before. Not always a great time to start exercising. But if
don't start spinning at Soul Cycle.
Don't start spinning. Don't start training for a marathon as you're 5 months or 6 months saying, I got to get into shape. But going slowly, the best thing you can do is move. Movement is what your body needs.
Yeah.
And it's actually when you're being told to be sedentary or you're in so much pain, you can't move, that's when you watch things get worse, not get better.
Yeah.
Yeah.
I know that we mentioned when we were talking downstairs, can you change the way you sleep when you're pregnant? Will that make a difference with things like sciatica and back pain?
Unfortunately, it makes a big difference. You don't have as much flexibility when you're pregnant.
Right.
As soon as you start to get a bigger belly, people say stop laying on your back. When you have back pain, one of the best positions to sleep in is on your back.
Yeah.
So, when you're pregnant and you're limited, the best thing you could do is be on your side, never on your stomach.
Of course.
And if you take that big body roll that someone's told you to buy and put it between your legs, that's the best position to be in when you're sleeping.
Oh, that's excellent. So on your side. And do they always say to stay on your left side and not your right? Is that?
They do, and that's for heart flow and blood flow purposes.
Right, okay.
Unfortunately, is that always good for your back? Not if you have bursitis on your left hip. So, when you're pregnant, you have to be sensible, and you have to throw some of the other rules out the door where you're supposed to sleep. A lot of when you're pregnant is not what am I supposed to do? It's what can I do to get comfortable so I get a good night's sleep, so I can do this.
So I can cope
so I
with
can
being
get
pregnant.
to the end zone.
Exactly. Okay. One of the other things that I'm like a walking advert for this video.
I love it.
Carpal tunnel.
Yeah, so
explain quickly what it actually is, carpal tunnel, because is it in the wrist?
Yeah, that's a loaded question too.
Okay. Yeah.
There's no straight answers, but carpal tunnel is basically a tunnel of bones. So you have 8 little pebble-looking bones, and they form a circle. And in that circle, the wrist flows nerves and some arteries.
Yeah.
So there's some carpal nerves that flow there, the nerves that actually help the hand feel and move. And sometimes if those bones move out of place or if there's swelling in that tunnel, you can get pressure on one of those nerves that affects your hands, and it can lead to hand pain. So as far as carpal tunnel during pregnancy, which is a very common symptom, it may or may not be true carpal tunnel. That's what carpal tunnel is. You might have pressure over here that's causing your hands to go numb.
Right.
You might be sleeping weird and your neck is wonked, and that's causing your hand to go numb. But most people, when they have hand numbing, they're calling it carpal tunnel.
Right.
In any event, it always goes back to the same thing. Maybe stretch your neck a little bit. A lot of times, I think actually the carpal tunnel of pregnancy is because we inflame as we get more pregnant, or your body just holds a little more inflammation.
Right.
You start to gain weight, you start to have more blood circulating, and it all can cause these vulnerable things in your body to have pressure. So it might be a change in diet, it might be a change in sleep, or walking always can help some of that swelling.
I think one of the great things about Dr. Brodows, what we love about her, is that she always talks about the fact, don't just reach for medicine straight away. You're such a great believer in that, aren't you?
Oh, I live
try all the, well, she does, she lives that, exactly. To try things like walking, to try different alternatives first, then to see a professional before you reach for, I don't even know if you're allowed to take Advil. We probably shouldn't say any names, but any type of medications, yes. So before you reach for medications, please think about some of the things that Dr. Brodows is telling you and try those first.
Yeah, I think, always as a chiropractor, and I am passionate, I say don't reach for medicine first. That should be the last thing you go for. Maybe there's a stretch, maybe there's an exercise, maybe there's something you can eat, something, change in diet that can help some of your symptoms.
Ice.
Ice, for sure. When you're pregnant, you almost innately know, I don't want to take medicine. I know medicine affects this fetus. You know it for some reason even more so. So it's a really good opportunity to kind of reflect and say, well, what else can I do?
Yeah.
And a lot of women do that, and they actually stop. They reject the medicine at that point and say, well, I don't want to live in pain. What are my options here?
Yeah, that makes complete sense. I love that. I love that whole ethos.
Awesome.
So one of the things that, actually I didn't get this, but I know we had so many mums writing about this, reflux. Is there something, as a chiropractor, I was really shocked that people asked the question, first of all, and then when you said, oh, actually, we can do stuff for reflux, I was like, that's funny, because we had questions about it, and I was like, no, you can't fix it, can you?
Well, that's a loaded question.
Sorry, everyone, I keep going with a loaded question.
They're all loaded. Yes and no. There's a lot of reasons for reflux. It might just be the baby is starting to get so big and push upward against your stomach, which is coming up, into your upper organs.
Yeah.
And so you're getting reflux. And so, no, we can't really help that. But a lot of times it's for other reasons. It might be your mid-back is getting so tight and draining some of the nerve flow or the balance that goes to your stomach, so you're now producing too much acid. And those are the things we can help.
Amazing.
So the answer is always get checked. There's so many alternative things you can do where you don't need Prevacid and Nexium while you're pregnant. And you may not even have to live with reflux. But can I help? The question is a very individual
Okay,
answer.
so I would suggest, again, if it's something that's really bothering you, come and see someone like Cathy and just let her take a look at you.
Yeah, if it's a one-time thing,
it's
it lasts a day or two, you don't really need anything.
Yeah.
That's our body, and your body needs to learn how to change and adapt.
Yeah.
But a week, 2 weeks, 3 weeks goes by and it's not adapting, get involved with your body. There's things you can do.
Listen to your body.
You got it.
Okay, so this last one, I'm going to ask the question. It might be loaded. But I know that we briefly touched on infertility, and we're going to finish with this one, but I know it's definitely something that you and I have discussed that we'd love to do another video on. We have so many mums and dads that have come to us and that have done our course, that have done infertility treatment. And I was really surprised to hear that some people worked with a chiropractor. So when you and I discussed it, you said it's definitely something that people can look at as an alternative instead of maybe going down the medicinal route straight away.
That's right, and I've worked with that a lot, and I can tell you tons of incredible stories, but let's leave that for another time. That's a lot to talk about.
So, sure. But we know that it's definitely something that people can use as an alternative.
Absolutely.
I love that.
Absolutely.
I love that. So watch this space, mummies, or future mummies, if you want to discuss a little bit more about infertility. Watch our next interview with Dr. Brodows. Thank you so much.
Look forward to it.
Thank you.
Nice.
Thank you.
Great.
Thanks, everyone. See you soon.